Genomic testing has significantly changed how lung cancer is treated. In those patients who have activating mutations or changes in the cancer cells where we can use targeted therapy, the outcome is significantly better. And so for that population of 15 or 20% of lung cancer patients, this has changed their life significantly. Genomic testing is testing the DNA of the cancer cells to see if they have any changes or mutations in the cells that may have led to the production of the cancer. These changes or mutations, which are most common in lung cancer, can be used as a target for treatment. The difference between targeted therapies and traditional chemotherapies is that targeted therapies really are going after the specific cause or the specific molecule that is abnormal and producing the cancer. Chemotherapies are just designed to kill cancer cells or any cell that's dividing rapidly. It's not going specifically to the cancer. It's just a toxic drug that kills any cell. Genomic testing is most important in certain patients with non-small cell lung cancer who have a type of cancer called non-squamous carcinoma. And those are several types of cancers: large cell, adenocarcinoma. Those are the patients who are most likely to have these mutations and to benefit from the testing. What these mutations do really is perpetuate the signaling from the outside of the cell to the interior of the cell, and many of these signals are signals for growth and development. And so when these molecules are mutated, they are sometimes turned on, and so they continuously signal for cells to divide, replicate, grow, go outside of the tumor itself. Genomic testing is really appropriate right now for patients with advanced or metastatic disease or stage 4 lung cancer. We are doing clinical trials in patients with earlier stages of disease and patients with locally advanced cancer, and some patients in the adjuvant or post-operative setting in patients with early stage disease. But the results of those trials are not final. And so we tend not to sequence or not to do genomic sequencing in those patients. As a patient, it's important to ask whether you're getting comprehensive genomic testing, because there are some mutations that, while we don't have treatments for them immediately, we may be able to use treatments that are not specifically FDA approved for that indication later in treatment.